Thank you very much, Scott. Excuse me. Now we're going to take a slightly orthogonal look at the issue with Sam SHEKAR, who comes to us from Northrop Grumman and is involved in some slightly different big data issues. Thank you, Sam.
Thank you very much, Martin. So in a former life, I spent 20 years in the U.S. Public Health Service. It's good to see a number of my former colleagues here today as well. So as Martin indicated, I am presenting an orthogonal viewpoint, one from the health information technology field. So hopefully through this quick conversation, you'll see a little bit about what we're doing, both as an industry and as a company in this space. And obviously there are very strong relationships between data science and regulatory science. But certainly you're doing a lot of great work in regulatory science, and I want to applaud that, both what FDA is doing and the industry. So yesterday there was some discussion about big data and whether that's too often used term. But let's start with a quick reminder of why big data may still be an accurate and operable term, at least in some areas. And these are the 5 V's, and many people in this audience, of course, know this: the volume, velocity, variety, veracity, and to that we add value. The 5 V's of big data. What makes it big? It's not just a question of volume, how much is it? Although 90% of the world's data has actually been created in the last 2 years. It's not just a question of how fast it is, velocity. 170 websites are being created every single minute. It's not just a question of variety, how many. 70% of the digital universe is created by different users with different interests, very heterogeneous set of developers. It's also not just about veracity or how true it is. 1 out of 3 business leaders don't trust the information they actually use when they're making their decisions. It's also and ultimately about value. How useful is it? 65% of senior executives, according to the survey, say their management decisions are increasingly based on that hard analytic information. So it's important that we get this right. There are many challenges in data science, and I won't go through all of them, and certainly not in depth in this short time, but data scientists, we believe, are the foundation for solving today's big data challenges. And there are many of these challenges, ranging from data storage, cloud, semi-cloud, local environments, trade-offs between security and access and cost. Data and PII security. Only a few data systems, storage systems, have proper certifications for protecting PII that are either HIPAA or compliant or FedRAMP compliant. An Accenture report recently said that cyber attacks are expected to increase over the next 5 years to cause as much as $300 billion in healthcare arena lifetime revenue loss. So again, cyber and cybersecurity is an extremely important issue, particularly in the data science field and those who are concerned about data science. Raw data standardization is also extremely important. A number of times yesterday, people were talking about the need to create common protocols, databases, vocabularies, the need to have the variety of data formats somehow integrated or interoperable so that we can create similar language. Computing power is extremely important, and there are a number of solutions to address the greater need for computing power, ranging from Hadoop, which is a software framework for distributed storage and distributed processing of very large data sets on computer clusters, as well as virtual machines, VM, and we talked about that as well, I believe, a little bit yesterday. Standardization of analytic methods also came up. Of course, differences in methods can lead to differences in results, so we need to create some standardization along those forms. And there are a number of other issues, including transparency, so that methods can become fully disclosed so they can be replicated in other venues and other areas. And then IP issues. Who owns the analytic methods and why would they want to share? And then finally, most importantly, sharing data and analytical results. As Alistair Wood mentioned yesterday, who owns the data is a central question that we need to really be addressing. But there are many additional questions. Where will we store all that information? What are the legal ramifications of storing that? Do we put it in a central location or a distributed database? How do you prevent a user from accidentally or maliciously deleting or altering shared data? A very important issue as you start thinking about the clinical interface is how to interpret and present that data to community clinicians, to patients, to payers. There is a clear need for more translational science, risk communication science, and implementation science, all of which can support regulatory science in order to best address these challenges and concerns. So I'm reminded of Levitt's diamond that Jim Stevens talked about yesterday, where we were looking at structure, task, technology, and at the heart of it, the foundation of it was people. And that the people were really a critical element in order to move this whole foursome forward. And the people in this case are the data scientists. They're critical to developing needed solutions for big data challenges that were just alluded to. So this cartoon is basically a description of a modern data scientist and what has been sometimes called the sexiest job of the 21st century. So what makes a good data scientist? According to the Harvard Business Review, it's a hybrid of a data hacker, an analyst, a communicator, and a trusted advisor. In addition to the math and computer science that's necessary, domain knowledge is very critical because it is that intersection that allows statistical significance to actually create meaning. And data science, as you can see, is the confluence of mathematics, comp sci, and domain expertise. One of the data scientist's roles, in fact, is to move an organization up through this combination of talents from in analytic sophistication, from descriptive to diagnostic to predictive, and ultimately to prescriptive analytics. Data science workforce issues are critical, but the challenge is pretty straightforward. We just need to develop a data science talent pool that can capitalize on this growing data ecosystem. Data scientists can help uncover new information, optimize processes, improve precision, make better decisions for the organization, and mature an industry along that continuum of analytic sophistication I just mentioned. Yet, according to an off-cited McKinsey study, the U.S. may be facing a shortage of anywhere from 140 to 190,000 people with deep analytic skills. On top of that, we also need over 1.5 million managers to be able to correctly interpret and utilize that data on the recommendation of the data scientists that work for them. So there's a huge need to develop data science sophistication and understanding across a wide swath of the business population and academic population. Learning and training opportunities have been developed in a variety of venues, and you've talked about some of those here. Certainly CERSI was mentioned. Some other examples include the Michigan Institute for Data Science, or MIDAS, which has earmarked a $100 million investment over the next 5 years to focus on developing data scientists as an interdisciplinary curriculum. 120 affiliated faculty are already involved in this issue from 11 different schools on campus. And the focus is on learning analytics, transportation, social, and health sciences. And they've even started a new undergraduate program in data science at that campus. There are other examples, of course, other programs and degrees in these fields. And non-traditional online learning, Coursera, MIT, and others have been developed to help create and stimulate supply in the data science arena. In the industry, there is a clear need and an understanding that it's not sufficient to just be on the receiving end of production of data scientists. We need to also help stimulate that ourselves. So there's been a number of internal training programs that have been developed. In fact, an MIT Sloan study revealed that 63% of companies are actually turning to on-the-job training. And that makes a lot of sense because that domain expertise is critical to help showing familiarity with the company's processes and goals, the last mile challenge. So very quickly, I'll just describe a little bit about the health division at Northrop and why we use data science. So we're involved in population health and health analytics, benefits management, and science solutions. We support a number of federal agencies. We have about 1,500 staff, of which 1,000 are IT professionals who all day long are working on health issues, but don't necessarily have that direct health, formal health training, but are supplemented by 200 public health professionals and 300 business professionals. We have developed both internal and external training programs, and I'll talk about those shortly. Internal data scientist workforce focus, as well as partnering with universities to develop data scientists for national priorities. One of the programs internally is called the Future Technical Leaders Program. There's a program that allows us to have recent MS and PhD engineering grads enter as engineers, go through 3 one-year rotations on different size projects, and work with under senior technological mentorship and also exposure to C-level NG employees. I have a colleague here who's actually benefited by working with, who's an FTL, Dr. Lauren Tuft, who's in the front row, and she's an example of one of our outstanding FTLs. We also have an internal training program for undergraduates who have joined us within 2 years of degree completion. Externally, we're engaged in a number of partnerships. One of the key ones we're engaged in is called the Center for Hybrid Multi-Core Productivity and Research, or CHOMPR. This is a partnership with UMBC, UCSD, Utah, NC State, and other universities, and includes other companies and also federal agencies. It's an elite industry university agency cooperative research center and consortium that focuses on university training and joint projects. We also have, as obviously, cyber is a very important issue for us, and so we engage in two different programs related to cyber. One is a training program called Cyber Patriot, involving STEM involvement, and we can talk about that more during questions. And then the SYNC program, which is, again, a partnership with the UMBC on tech innovation and helping startups hire data scientists to support industry interests. Finally, the North Carolina State University Practicum Project, which is an activity we engage in to, again, support student interest in data science. These are just some examples of data scientist efforts. Don't have time to go into the details, but as you can see, working in all sorts of ranges of scientific data analysis. And then finally, in conclusion, data scientists drive big data solutions. They're key personnel in harnessing multiple sources of data to help achieve health and scientific goals. There is a clear workforce challenge that we have a tremendous shortage of data scientists. The traditional training pipeline will not be sufficient to provide the data scientists this country needs to solve critical problems in academia, industry, and agencies. We need to develop both internal training programs and external partnerships in order to address those needs. The value in regulatory science is clear. Data scientists can help reveal unknown drug interactions, can help link genetics with treatment, can help with tracking AEs and ADRs, and as a result, help improve the nation's health through a focus on safety, efficacy, and efficiency. Thank you very much.